Well, thank you so much for coming on today. I'm excited. I think Amol and I have talked about Patient Prism, and it's a patient acquisition tool, and we're going to talk about it a little bit here. So there's a huge difference and a huge opportunity here for you as a private practitioner. And this is why I think working with Amol is great, because I'm a private practitioner for 20 years. I don't own a DSO. I don't have 5 dental practices. I don't have 50 dental practices. And the squeeze is on us to be more efficient, to be more effective, to be more valuable, to value the dollar that we spend for external marketing to bring in sales. Well, if I'm more efficient and I close those holes, guess what? My cost of acquisition in this example drops to $50. I've doubled my new patients potentially monthly.
And that's how you compete, right? That's how you compete for the same dollars, right? You've got, if your cost of acquisition is $50 and you're spending 2 grand, it's 40 patients compared to a competitor whose cost of acquisition is spending the same amount of money and spending $100 per acquisition. That's how you compete.
I'm upset because I wish I knew this 15 years ago.
It didn't exist, right? It didn't exist.
But you get my point. My point is, boy, how many mistakes have I made? How many missed calls have I had in my place of business since 2003 when I got into business? It's crazy. And even maybe the last month.
Well, here's the thing. Here's an interesting statistic from our performance report. Here's 5 patients that could not schedule an appointment because you didn't have room on the schedule. Like, how do you not, like, not knowing that man, my schedule is not optimized. I don't have any room. My days booked out is 55, right? What do I do, right? These are the things. See, this is what what AI does. It takes hindsight. Hindsight is what happened in the past, creates insight from it, right? Okay, well, 5 patients of mine could not, new patients could not come in because scheduling was a concern, right? And now based on that insight, now I'm going to project foresight. What I'm going to do, I'm going to figure out, can I expand my hours? Can I optimize my schedule? Can I open up on weekends? This happened a lot with our clients in the pandemic. That knowing that's intelligence. Data and intelligence are 2 separate things, right? Data is just hindsight. Insight is where AI says, well, I said, by the way, they didn't have any appointments available. And that's why they couldn't get in. And during the pandemic, we made such a big impact with our practices. We called them and saying, guys, open up a little extra hours, open up on a Saturday. You can't afford to lose these patients. They need to be seen. They need to get their perio maintenance visits done. Those things were important. And that's what this does. This is not just a software platform that tells you how many calls you missed or what did you not do, but also tells you operationally that your schedule might not be optimized. You need more capacity. You need to add an operatory. Those are the type of things you need to know.
Well, I tell you what, we're a little bit out of time now, Amol. We got into this, and I know there's so much more to present here, but what I wanted everyone to realize is I'm excited. You can already tell some of the missed opportunities that you're having in your place of business. And the relationship that I'm going to be working with Amol here is to do just that. Come into your business at a high level, show you these dashboards, show you these opportunities that you can have that exist in your place of business right now without you spending any extra dollars. And you'd be very excited about that. You got to be. If you got 400,000, you can get 75,000 back. That's a lot of fillings that you have to do in order to fill that gap in. So I think efficiency, operation efficiency, and I think the key word here, patient acquisition tool, and as Amol stated here, it provides more than just that. I mean, if you're booked for 2 months and your production is not very high, then you're not being very efficient in those hours. So, 1, increase your prices, 2, learn how to treatment plan, but 3, also add evening hours, add weekend hours. Those are some things, because you're losing all those patients simply because you can't fit them in. So whether you're a DSO or a private practice, I know at times I've talked to private practitioners that say, I'm so booked with my hygiene patients, I can't get anybody in. I have 2 hygienists working 4 or 5 days a week, and we're booked for 6 weeks or 8 weeks. Well, these are some things that you can pay attention to at a high level and be able to help you. So with that said, Amol, listen, man, thank you so much for your time today. For if anybody's interested in contacting Patient Prism, obviously you can reach out to me directly. You should all have my cell phone. You can schedule a demo as you see here. But as we move forward, patientprism.com is the website you want to go to, and you can schedule a demo. But as we move forward, implementing an hour of coaching as well is going to be very valuable, because you need to start paying attention to your business. And I hope you all respect the importance of that. Amol, thank you, my friend, for your time.
Thank you. It's a pleasure and honor to be with you. And I look forward to our partnership going forward. I think we're going to be able to help a lot of people.
Thanks, buddy. I'll be in touch with you. Have a great rest of your day.
Bye-bye.
All right.